Every year in Australia, over 126,000 patients undergo joint replacement surgery, and this reduces their pain and improves their quality of life. Unfortunately, due to the global impacts of COVID-19, it's not possible for elective joint replacement surgery to currently occur. This means that every week in Australia, over 2,400 patients are missing out on an operation to take away their pain. So I thought I'd give some basic advice for patients and families on how to manage your joint pain during this really challenging time. My top 5 recommendations for managing severe joint pain are: number 1, take a variety of pain medications. Number 2, take your pain medications regularly. Number 3, have a backup plan if your pain gets very bad. Number 4, keep active. And number 5, keep in regular contact with your GP and pharmacist. And that last point's really important because your GP really is the ringmaster in your overall pain management strategy. They know what medications are best for you to take, and also if they will interact with other medications that you might be taking. So let's get started by understanding how your pain works during a normal day. So up here I've got a scale of 1 to 10, and that's how we as surgeons often ask patients, how bad is your pain? Think of 1 out of 10 pain as being like a paper cut, and 10 out of 10 pain being the worst pain you've ever possibly experienced in your life. And on the bottom here we've got morning, afternoon, evening, so basically a 24-hour day for the average patient. If you're a patient that's waiting for a joint replacement, your pain is bad, so your pain is never down here. During the day, as a minimum, you track along as a minimum 5, 6 or 7 pain throughout the day. But then what happens is you have to live your life. Now whether that is doing a shift at work, getting off the couch to cook dinner, or for some people even just trying to sleep at night, those activities or certain triggers cause spikes in their pain. And so you go from a 5 up to a 10, and your pain is very high. When that happens, most patients use what I call a pill in the pocket approach. Their pain flares, it's very high, and they go and grab some Panadol or some anti-inflammatories like Voltaren or Nurofen out of the cupboard, and they take it. So they take that there. And what that does allow is for their pain usually to settle back down again. It never goes to 0, but it might come down from the very high peak of pain they've had. And that pattern really continues throughout the day. They get up and make breakfast, it goes high, pain relief back down, high and back down. So what you can see is each time a patient is experiencing pain, they're treating that with pain medications. The problem is that most patients, by doing this, are using the wrong approach with their pain management, and they're chasing their tail. They're never ever going to suppress their pain and bring it down here. The pain will continue to smoulder like a fire. And every time the wind blows and your pain flares, you throw a cup of water onto the fire to try and douse the flames, and that cup of water is the Panadol or Nurofen that you might take every now and again. The problem is, whilst that does settle down the flames, the fire continues to smoulder, and you're always running at a reasonable level of pain. The reason I'm using this analogy of a fire is number 1, to help your understanding, but number 2, the best evidence we have from pain specialists is that something called kindling exists in your pain system within your body. What that means is, if you're in chronic pain and your nerves are constantly being assaulted with pain signals that go to your brain and let you know that you've got pain, then your pain receptors are really wired up. They're like sitting on the edge, waiting to give you pain, and when they cause pain, the pain will be much greater than it otherwise needs to be. So kindling is this analogy of a fire that's kind of smouldering, and it's very likely to flare if and when the wind blows. The best way to suppress that kindling or douse the flames of that fire is regular pain relief to dampen the entire nervous system down and stop those flares really happening. So it's not just about timing of medication like I've been saying and variety of medication, it's also about dampening down your nervous system as a whole and stopping it being so hyperactive as it's been accustomed to because you've been in so much pain for so long. So let's think about the pain scores that people with bad arthritis have. They're hovering around here with big peaks and spikes in their pain, and they're trying to use medication at these points to control or reduce their pain. Now let's look at 2 very cheap, inexpensive and usually very safe medications to help control your pain. So paracetamol, or Panadol as it's often called in the community, is very safe and it's reasonably effective for joint pain. But the problem is you absolutely must take it regularly, because if you only take it when you feel pain, you've already missed the boat. The horse has bolted and your pain's flared and you're going to keep chasing your tail. So the maximum dose of pain relief for paracetamol that I'd recommend taking is 2 tablets 4 times a day. So here's our paracetamol in blue. Let's do that as 2 tablets, 2 tablets, 2 tablets, and 2 tablets. And you're going to take that 4 times a day or 6 hourly. What that will do is that the Panadol in your bloodstream will rise and will create a nice level of solid pain relief throughout the whole day. The second thing that you should consider taking is anti-inflammatory medication. Now, anti-inflammatories are one of the most misunderstood medications when patients speak to me. They've got a lot of misconceptions about it. An anti-inflammatory is not designed to reduce swelling in your joint, it is designed to reduce pain. It blocks pain by reducing inflammation chemicals in your joint. And because arthritic joints are very inflamed, anti-inflammatories are extremely beneficial for reducing joint pain. But again, the key is to take that regularly, so that there's a regular supply of anti-inflammatory medication in your bloodstream. There are 2 ways of taking anti-inflammatories. Common garden variety anti-inflammatories like Nurofen, Advil, Voltaren. If you're taking those types of anti-inflammatories, you would take them 3 times a day. So 1, 2, 3, perhaps in between the spacing of your Panadol. My best advice is that long-acting anti-inflammatories or slow-release anti-inflammatories, a good example is one called Mobic. You just take 1 of those tablets and it lasts all day. It lasts for 24 hours. The great thing about that is you've only got to remember to take it once a day, but also if you're like many of my patients and you've got bad pain at night, if you took the Mobic or the long-acting anti-inflammatory an hour or 2 before bedtime, you'll get great pain relief through the night as you sleep, and you won't be waking up for your next dose of anti-inflammatory. So as you can see here, we're taking regular Panadol, regular anti-inflammatories, and what that will do to this pain curve is rather than having all these peaks and troughs that we're seeing, the pain curve will flatten like this. So yes, when you get up and walk the dog or go to work or cook dinner, you'll have a flare of your pain for sure. But the peak will never be as high as it was before, and they'll be much more manageable, and overall we're pushing this pain score down and down and down. But the only way to do that is to take the pain relief regularly, and if you don't do that, you're just going to end up chasing your tail. So now we've spoken about paracetamol and anti-inflammatories, and we're taking them regularly throughout the day, whether we're in pain or not. That's what's crucial. The third medication, if you're still in pain, that you can add is Tramadol. So note here, when I said before, one of my top tips was taking a variety of different pain relief. The reason, again, for that is that each of these medications hits your pain from a different angle. It works on a different part of your body. So we're hitting the pain from the front, back, and the sides, you might say, with taking these 3 medications. Again, these 3 medications are for most people very safe to take together, and you could talk to your GP about that if you had further questions. Tramadol is a medication that also comes in a slow-release formulation. So to make your life a bit easier, you could be taking 1 Tramadol in the morning and 1 Tramadol at night, and that's going to give you prolonged, sustained release of Tramadol throughout the day to, again, work in conjunction with Panadol and your anti-inflammatory. So now let's put the Tramadol on the chart. So we're going to take a Tramadol in the morning and a Tramadol in the night. And again, that's a long-acting formulation. So it's going to work all the way during those 24 hours. So hopefully what this is doing even further is, although we're also completely pushing down and flattening our pain curve, we're also now going to be seeing a reduction in the spikes of pain, so that the spikes of pain will probably happen less regularly because there's already pain relief on board before the spike happens. The analogy again is we're chucking buckets and buckets of water on that fire 24/7, so when the wind blows, the flames can't flare and give you a really bad attack of pain. So when you get off the couch and you use your hip wood grab and you go, oh, that's painful, and I go and take some anti-inflammatory, you probably won't need to do that because this is already acting. So now if you're a patient with bad joint pain, hopefully you're taking regular Panadol, a regular anti-inflammatory, and maybe even some long-acting Tramadol to help your pain. Over here I've written 4 natural supplements which you can then also add over the top of all of this to further help your pain. Now, fish oil has a significant body of very good evidence around the world that it can actually help reduce inflammation in your joints and therefore reduce your pain. Again, you have to take it regularly and you've got to take quite a decent dose of it. Your pharmacist can recommend a dose for you and also a particular brand. There's less good evidence on glucosamine and chondroitin, but they are quite cheap and they're very safe. So these are things you could trial, and if they're having an impact you could use them, and if they're not you can drop them. There's actually increasing evidence that curcumin, which is the active ingredient in a spice, which you might know as turmeric, that curcumin is a natural anti-inflammatory. And I think the signs are quite promising that this does have a lot of potential to be a good supporting supplement to help your joint pain. So all of these natural supplements could be taken in conjunction with the medication that we've talked about before, and in combination they'll have an even bigger effect on reducing your pain. Remember that no one single medication will take your pain from 10 to 0. However, taking regular medication and a variety of medications and supplements will, holistically, significantly reduce your joint pain. Now this isn't exactly correct, but let's just say that for each of these we've got up on the board, if each of them reduce your pain score by 1 point and you took 7, then your pain might go, for example, from a 10 down to a 3. Now of course it's not that simple, but it just serves to highlight this is a real team approach. We want to hit your pain from every single angle we can, side, back and front, to help reduce it and give you a much better quality of life. So here is our idealistic best case scenario for your pain relief. We're taking regular Panadol, a regular long-acting anti-inflammatory, regular long-acting Tramadol, and perhaps some natural supplements as I've just described. And hopefully they've pushed down our pain and we're cruising along in a much happier world with our pain. So what happens if, despite a really great pain management strategy with everything I've already spoken about, you trip in the garden and jar your knee, or you sleep funny on your hip at night and wake up in horrible pain, and despite all this, life is very miserable? Well, there's another option that we can add to your pain relief that is very, very effective, as what I'd call almost a get out of pain free card. So what I'm talking about is a cortisone injection into your joint. Again, this is an area where a lot of patients have misconceptions. How many can I have? Won't it do further damage? Is it safe? I've heard bad things about them. The reality is this: a cortisone injection, as long as it's being performed by someone who's very skilled at doing them, especially under ultrasound guidance, is minimally painful and the risks are exceptionally low. A cortisone is really an anti-inflammatory agent that works inside your joint, and it stops pain production inside the joint. It will not cure your pain, it will not reverse your arthritis, it is just taking away pain and inflammation from inside the joint. But rather than taking a tablet in your mouth, which has to get into your bloodstream and head throughout your whole body and go to all your joints, this is a focused area of pain relief to one joint, say the shoulder or the knee or the hip, for example. The other option you've got in terms of a plan B, if you've taken all these medications, you've had a cortisone injection, you're still really, really struggling and you can't access a joint replacement promptly, is to speak to your GP about a short course of something stronger. The first question your GP will ask before prescribing that is, have you tried all this? And that's the other reason it's really, really important to try and do the simple things right. Because hopefully we can avoid very strong medications and control you with this. But if you are in a genuine situation and you're really struggling, it's worth talking to your GP about a plan B. The other key recommendation I've got to control your joint pain is to stay active. And the best person to help you with that is a really good quality physiotherapist. One of the main aspects of all the pain relief that I've been talking about up until this point is so that you can keep moving, you can keep doing your job, you can keep doing the hobbies that you like to do, and you're not in horrible pain laying in bed or on the couch. The other aspect of the pain relief is to enable you to do rehabilitation or prehabilitation if you've got upcoming surgery. So a physiotherapist can keep all the muscles around your joint as strong as possible, and they can also keep the motion or the movement of that joint as normal as possible. So even if you never end up having a joint replacement, seeing a physiotherapist is of benefit for all those reasons. If you do end up having a joint replacement, what it means is that you will arrive at that joint replacement with the best possible strength and balance and movement in that joint. And what that means is that after surgery, you're already starting at base camp. At least you've got some decent strength and movement in the joint, and you can then do your rehabilitation after surgery, and in most cases get a much better outcome than if you arrive at your surgery with a very stiff, painful joint. So they're my top 5 recommendations for helping to control your joint pain from arthritis. Hopefully what I've given you is a framework where you can make personal choices and navigate through your own pain. Some things will work for some patients but not the next. The most important thing is that you're in control of that process. Ultimately, if you're still in pain and your quality of life is reducing, you may actually need to consider having a joint replacement procedure. If that is the case, then you could ring myself or one of my colleagues and book an appointment or talk over the phone. We're always happy to help you understand more about what your options are.